We want to welcome all of you to our Committee of the Whole.
This meeting is being recorded.
Salt Lake County Council on this Tuesday, September 15th of 2020. And this meeting will be conducted electronically via WebEx events. Agendas, audio, live streaming recordings, and meeting minutes can be accessed at slco.legislatar, that's TAR.com. The council will also broadcast live stream, have a broadcast of its meetings on Facebook Live, which may be accessed at facebook.com/SLCO Council / and through Cisco WebEx. If you'd like to access the meeting, you can go to our website and get the agenda, which has all this access information on it, and also give any comments that you'd like the council to have for our meetings. And that's kind of how we handle things. And it's just not good to have people attending our meetings at this time of our lives with the COVID-19 issues that we all face. And we want to keep everyone safe, and including the council and our staff. So I think that pretty much covers it in a nutshell, that we how we're handling things today. I'd like to say that that's part of our call to order today, that announcement, and that's given by myself, Max Brady, the chair. So with that said, I would like to move to citizen public comment and see if we have received any comments, or if anyone might be contacting us electronically to give us comments. And Shaquille, do we have anyone or anything?
We do have Steve Van on.
Good afternoon, Mr. Chair. I have no comment at this time.
Hello.
Oh, can you hear us? Uh-oh.
It looks like I might be getting updated. Can anyone hear me right now?
We can hear you, yes. So I'll just quickly note, we had Steve Van Maren on the meeting with us, but he said he had no comment at this time. And I'll also note that I just barely received a email from a Mr. Nathan Jensen that I will forward to the council and ask the clerks to include in the minutes for this meeting.
I guess I could go like that and say, hold on, I think it's updating.
I'll text him.
Councilman Jensen, are you there?
Now he's getting my text.
Can you guys hear me now?
I'm here.
Yes.
Okay. Did you hear any of that opening?
Yes, we did.
We can hear you.
Oh, I'm so glad.
Yes.
So I went into citizen public comment. Shaquille, do we have anything that you would like to bring forward from any of the citizens?
I already mentioned Steve Van Maren was on with us, but he has no comment, and I did receive an email that I will forward to the council members.
Okay, great, thank you. My iPad went into dating thing, and I'm sorry, I was offline there for a couple of seconds, so I apologize. Okay, with that said, we will close public input, and we're going to move on to item 3.1, which is a special recognition, and it's a very special one. So I will turn the time over to whoever is leading that discussion.
That's me, Mr. Chair. Mr. Chair.
Great.
Can you see me?
Great.
We've got a packed house here at Command Central today. So thank you. And we are catching most of what you're saying. So so far so good on that.
We should have all showed up.
I love the title card approach though. That was awesome. Okay, well, first of all, I want to say we're going to talk more in the agenda at a later point about our 6-month report on COVID. And we just wrapped up a press conference on that here at the ECC. But I also had the opportunity today to join the governor at the opening of Pamela's Place. And you all know that we have many community partners working on supportive housing and homelessness. And I was so appreciative to be with Pamela Atkinson today to recognize her. But the special recognition today is to actually a couple of other people that have worked diligently on behalf of our homeless population. And as we look at COVID and the measures taken to address it, we just really felt as a team, each of us has value to our respective efforts around COVID and around government. But my friends here, David Lipvack and Aaron especially, have moved mountains. So we're here today to recognize you and to celebrate on behalf of the community as a whole, Salt Lake County, Salt Lake City, but especially our people experiencing homelessness in this community. So with that, let's roll the video. You know, as we're about 6 months into facing COVID-19, and I hope just a few months getting out of it, I want to share that there have been a couple of people that have been so instrumental to our county's success, and really people I could not live without. Aaron Lipvack, one of my deputy mayors, who has also taken the role as our operations chief under our emergency operation around COVID, and then her husband, David Lipvack, who's a senior leader at Salt Lake City and is working to combat homelessness.
David is the most good-natured guy, and I think that's what has made him such a good leader in all of the capacities that he has in Salt Lake City. And he assumes the best of people, which is a rare find for people in politics sometimes.
Everybody seems to know David, and also whether it's Republicans or Democrats, everybody seems to like David and respect him and have a positive opinion about him.
The word for me to describe David Lipvack is grace. Such a pleasant, wise voice, and that's so appreciated.
Aaron has one of the most infectious laughs. There will be meetings going on down the hall that I know are intense meetings. In the midst of it, you hear Aaron's laughter come and echo through the halls of the mayor's office. And it's just such a relief to know that things must be going well, that Aaron can bring some much needed levity to the most serious of moments.
I sit with Aaron in meetings a couple of times a week. It used to be in person all the time. It's now by Zoom quite often. I'm telling you, sometimes Aaron Lipvack scares me. She is so smart, and she has been at the county for so long, and you know, I'm the mayor, so I'm supposed to have all the answers. So I'll answer a question, I'll look around, I'll look at Aaron, I'm like, is that right? Did I get that right?
Aaron never brought me a problem without also bringing a solution. She would say, here's the challenge that we're facing, and here's how I think we can address it.
The relationship between David and Aaron, I think it's fascinating. They've been married for a long time. They know each other's strengths and weaknesses, and I think they're one of the nicest couples I know.
People have no idea what has been accomplished in our community because of Aaron and David Lipvack. It was an incredible asset when I was the mayor of Salt Lake County to have my key at the county married to the key person at Salt Lake City. When Salt Lake County and Salt Lake City maybe weren't seeing eye to eye, you had Aaron and David Lipvack things out and brought back to both sides a solution that we could enact and get things done.
David and Aaron are my kind of people. They feel our homeless friends are as important as other friends.
Right when the pandemic came, you know, we sat around the table and started thinking of strategies
things that we could do to help make sure that individuals were safe, and we knew that those experiencing homelessness were both on the streets as well as in shelters.
We needed to take our most vulnerable homeless individuals, move them out of shelters into quarantine and isolation at times. We had to come together and find new ways to serve the community.
What you see with the Litvak family is people who care deeply about their faith and who then put their faith into action, whether they're in the synagogue or out on the streets of Salt Lake City, are every single day epitomizing, living, and reinforcing Jewish values and what it means Jewish.
I am a little protective of David because he's an incredible and a finite resource. There's no one like David Litvak in the state of Utah. No offense to Aaron, they have different skill sets, but the county's got Aaron Litvak. Salt Lake City deservedly has David Litvak, and we don't want to let him go. So I said, you can have him to collaborate, but he's coming right back to City Hall when this is over.
I think it's actually almost blessed that Mayor Mendenhall had the foresight to put David in that critical role. The same time, under our new structure at Salt Lake County, Aaron Litvak was in a critical role related to people in need and our fragile populations.
I worked with Aaron and David most closely when we were working on criminal justice reform and homelessness and trying to provide better options for behavioral and mental health treatment for people who are experiencing homelessness. And Salt Lake City is the police department, the law enforcement of downtown Salt Lake, but Salt Lake County is the human services, the homeless services, the major funder of all of those services. So you really can't do anything to improve the situation of public safety and homeless services without having Salt Lake County and Salt Lake City on the same page.
One of the most proud strategies that we've deployed here in Salt Lake County in the response to COVID-19 has been a hotel program called the Stay Home, Stay Safe Vulnerable Populations Hotel Program. And this really is a demonstration of both David and Aaron's strengths coming together to help serve our community. We could design it, we could program it, we figured out with partners how to operationalize this great idea. But what about the hotel? Within minutes of going to Erin and talking to her about this, she was on the phone. She is a go-getter. She takes care of business.
So we found temporary housing. We found a hotel. Erin set that up. She was critical at building our quarantine and isolation operations that have proven to be such a success.
I just have a vivid memory of sitting around that table, and it's actually David's brainchild. He thought about creating a really dynamic, multidisciplinary outreach team. So bringing in law enforcement, bringing in public health nurses, bringing in the service providers who are helping to connect to a community and really building relations with those who are on the streets.
That's the kind of atmosphere and environment that David and Erin provide. It's conducive to working together, and it's conducive to listening and not putting people down. And that's how we problem solve and get the right solutions.
It actually is a model that I think could really be utilized beyond COVID. I think it's one of those things that if we're thinking about addressing homelessness holistically, this is one of those really innovative responses that we can all learn from moving forward.
Thanks to the leadership of the Litvaks and Catherine Fife and Mayor Wilson, our numbers are much lower than the general public in Utah. And we've been able to take the example of what's been happening in Salt Lake County and sharing it with the rest of the state.
From the parents running the kosher co-op to help provide food for those in our community, to the incredible holy work that both David and Aaron do for our Salt Lake community at large. But also I've seen this passion for social justice work in their kids too.
I have
a lot of respect for Aaron and David with all of the work they do in the community, but also as parents. You see how they're raising their kids to give community service, to care about others, and to be self-sacrificing in those endeavors. And they are bringing into our community some future contributors in their children.
David and Aaron are humble. They're quiet heroes in our community. They work oftentimes behind the scenes, and you have no idea the compassion and the effort and the thoughtfulness that they put into their work.
But it's not about advancement in power for the Litvacs, it's about service to the community. And I think that's amazing.
I think it's wonderful that we have this opportunity to say thank you to Aaron and David while they're still doing this great work with us, not at the end of their career. And I hope that they feel the love and the gratitude from the entire community as we take this second to appreciate them and now get back to work.
And sorry for the skipping and the technical glitches, but the audio was good, so it maybe made it a little slower too. Well, we appreciate you guys, and several of us really felt this was a recognition long overdue. So I think you heard from your mayor. I'm just waiting for the line. Somebody told me the line was going to be in there that David Litvak had two bosses, and they're both named Aaron. But short of that, you know, I know she appreciates you, David, in your role. I do, Aaron, and everyone in this room does as well. And the community is indeed blessed to have your leadership during this really critical time. So wanted to just take a minute, and I think as much as I enjoy working with you, I appreciate you even more than the connection and the joy in working with you, and I know the team feels that way. The service is really remarkable. And I said it earlier today, but as much as I'm here to recognize Aaron and David, I recognize each of you. This is quite a year, quite a 6 months, more to come, and you're all so incredible. And so the work you're doing will be long lasting. And I feel that way with my partners on the call. The council, you guys have been doing so much in your respective districts with your efforts to keep the community well informed and safe during this critical time. So I would be remiss not to not only thank these two, but to thank everyone as well. And that's all I got. I don't know if anyone else has anything, but that was fun to do.
Thank you, Mayor. What a tremendous video, and it doesn't even really hardly scratch the surface about Aaron and certainly David. Council, I'd like to go to council and see if anyone has some thoughts they'd like to add to these great words.
Max, this is Amy. I'll just chime in that it's been great to work with David, who was here at the county, and I know we were all sad to lose him, and obviously fantastic to have Aaron here, and so thanks to both of you for all your hard work, well deserved.
Let me add to that real quick. I got to know Aaron and David, almost 12, well, certainly 12 years ago, and what tremendous, marvelous people. And Aaron certainly knows how much I appreciate and love her. We have done so many things together, and I can add to this that anytime that Aaron would show up in my office or call to want to have an appointment, I certainly knew two things, and that was that this was an important situation or question that she needed to talk about. And she also knew pretty much all the information about what needed to be known about any issue. She always thought it was almost the county's greatest lobbyist, because she really knew how anything would affect all stakeholders involved. And there were always two sides or more sides, to an issue, and she could explain them all to you, and without showing a lot of excitement. I'm sure she has a lot of adrenaline running through her all the time, because I don't think she ever sleeps, certainly. But she's just such a marvelous person. I can't even name all the things that we work together on. You know, like as mentioned already, the criminal justice reform and homelessness, and all the open space park stuff. My gosh, and COVID is just, she's over the top on that. And I got to say, UPACA. You know, when we say UPACA, we're talking about the Utah Performing Arts Association and the Eccles Theater. And long before anybody even heard about Eccles or the theater, Performing Arts Theater, you know, Aaron was involved in that, and I came involved in it very early on, and we worked together along with many tremendous individuals, and I'm not even trying to name them. But Aaron was such a strength through that whole process, just even through, are we going to do it or not do it, and the design and the construction and grand opening and successful operations over, what, 3 years now, and reaching the goals we needed to meet. And I think Aaron can tell you that there weren't very many board meetings that on my way into the board meeting I wouldn't call her and just say, okay, let me know what we might be facing today, and what we might need to work on, and how you feel about things. And she was always right up there. So Aaron, we all love you. David, we all love you. You guys were a match certainly made in heaven, and certainly we hope this doesn't mean anybody's going anywhere. Aaron and David can just stay what they're doing, because I think they really are some glue that helps hold the county and Salt Lake City together. So anyway, I'll shut up, but thank you, Mayor, for having your staff put that together. I heard it was coming, and you just did a remarkable job. You know, it couldn't have been better. Thank you.
All right,
Okay,
that's it for special recognition.
Thank you, Mayor. We appreciate it. We're going to move on to 3.2. As you all of us pretty much know, there's a hiring freeze in effect at Salt Lake County due to COVID-19 life that we live. And so 3.2 is a hiring freeze exception report. Turn the time over to Brad Kendrick.
Okay, yeah, this is Brad Kendrick, the budget analyst for the County Council. For the hiring freeze exceptions, there are 12 merit positions, 1 time-limited position, and then 5 temporary positions, and nothing really too out of the ordinary.
Council, any questions?
No?
Hey, this is just informational, so thank you, Brad. Move on to 3.3, update on Salt Lake County's coordinated response to COVID-19. Mayor Wilson.
Well, thank you. I'll note that we just put the finishing touches on a 6-month review report that should be in your inboxes if it's not in your packet. And I'm guessing it's probably sent to you separately because they were working on it up until the evening hours, I'm sure, fine-tuning. I'll tell you right now what's on our minds are increased cases due to schools. I'm going to let Gary sort of put that in context, but we do know that in an effort to get kids back, we anticipated there would be some impact, and there certainly, in some situation, is indeed an impact. And of course, it's our hope that we can stay on top of cases, and that parents and schools will make the right call and, you know, keep kids away when they're exhibiting symptoms. So that, I think, is really what is of concern to the team as a whole, is just sort of watching our counts and seeing what more we can do in terms of interventions and partnerships with schools. And I don't know, Gary was here earlier. Oh, he's on in his office. So I'll turn it over to Gary and then to David.
Thank you, Mayor. Mr. Chairman, I want to recognize the t-shirt you're wearing. I didn't know that about you. You're muted, so I can't hear what you're saying.
All instruments, recording equipment, and all kinds of Beatles memorabilia, and we have a great time here.
Well, that's great. That's great. And I want to add my thanks to Aaron and David. They're an inspiration to me, and I appreciate being able to be associated with them and call them my friends. We've all seen that testing went down back in August. We're still mostly flat with our testing. I expect that with some increase in cases, we will begin to see some testing increase. Haven't seen that yet, but you know, the testing or the increase in cases just been over the last 4 or 5 days or so. That increase in cases, the most recent 2-week period, we have 2,343 cases. The 2 weeks prior to that, 2,172, so a difference of 171 cases. Just doing quick math, so a 7.9% increase in cases over those 2 weeks. Certainly watching that very closely. When we had our first increase that was reported last week, the thought was it might be that it was we were catching up as a result of the holiday and the windstorm and the effect that those had on laboratory as far as testing as well as analyzing and reporting. But it appears that it is not just catching up. And David will show you a graphic that will describe what we're seeing within the school population, but certainly seeing some increase there. And in addition, we're seeing possible new hotspots. As you know, we've focused mostly northwest part of the county, but we are starting to see some areas in the south part of the county that are having fairly high rates over the past couple of weeks. So talking about having some testing events in those areas. With the schools, there's each day presents some new issues for us with schools. We were on a call this morning with the superintendents and a few board members, a lot of questions about quarantine. They let us know, and we had already heard that even though the school doesn't host homecoming events, there are those events for students to participate in outside of the school setting. And we've got to figure those kinds of things out. And one of the board members asked, would it be safer to actually allow the school to sponsor those things and have controls on it, where out in the community, those controls don't exist. Of the cases that we have in our K-12 population, approximately 50% are in high school. So just those few grades in high school are accounting for almost the majority of those cases. Fortunately, we are not in Conversation Primary Children's Medical Center. They are not reporting an increase in hospitalizations or ER visits since school opening related to COVID. So while we're having more cases, we still continue to see that those cases in those populations are less severe. We continue to plan for vaccination. We are still planning on what we're hearing from CDC, receiving initial doses of vaccine late October or early November. That would be for very limited doses for healthcare, long-term care facilities, and first responders. It won't be until we're anticipating that first quarter of 2021 that we would begin to receive doses for the general public. We are working with the State Health Department on how all of that will be distributed, on what the priority groups are, identifying other players in the community who would be interested in assisting us with mass vaccination. So those efforts are well underway, and we're all anxious to be able to get that vaccine. I just want to make sure that we're all aware that none of the testing on the vaccine has been done on individuals under the age of 18. So they will not, those school-age individuals will not be eligible for the vaccination. Only those 18 and older will be able to receive it. So that still leaves that school-age population vulnerable. But again, they are the ones least likely to have serious complications. So I guess that's a positive there. My assumption is the soonest we would start to have doses for that population would be perhaps the beginning of the 2021 school year. That's my guess. I think once some doses start coming out for the rest of the population, then the vaccine manufacturers would begin testing on that younger population and go through series of tests, which would make it possibly available next October. So that is my report. I could pass it on to David Schuld for more of a look at data.
Okay. Good afternoon, Council, and thank you, Gary. Wanting to build off of what Gary spoke about regarding the cases, we are seeing an increase in the case rate increase due to the, we were seeing a lower but stable case count per day, and over the past 3 to 5 days, we've seen that increase, but it is still stable, just heightened than before. Our doubling rate has decreased. Our hospitalization rate has remained low, and I'll speak to hospitalization momentarily. Our mortality rate is under 1%. The number of tests completed, 290,170, with a weekly test total of 10,516, and our positivity rate is just over 9%. In terms of our total number of cases, our number, what I really wanted to focus on in this snapshot is the level of hospitalization. Our current hospitalized is 94. That has been over the past 2 weeks. We were at 129 2 weeks ago and have dropped to that 94, currently hospitalized. And this echoes the point that Gary was making on while we're seeing increases of case counts, the hospitalization remains stable and those hospitalized continue to go down. Our weekly testing and positivity rate analysis, again, week to week, with the number of positive cases against the positivity rate. I'm going to pause for a moment to the highest confirmed cases by zip code, as well as by crude rate. Just to remind everyone, when we speak about crude rates, if all of these zip codes had 100,000 people in it, is what we're looking at. In terms of the case count curve and where we stand, we are seeing an uptick in active cases. We are still, however, hovering around the June 14th when I originally started providing this information to council. We are at June 16th. Our 7-day case count is again fluctuating, but is at a plateau. Our rolling 7-day hospitalization count, however, has been the lowest it's been since March 26th. And that's 20 days after our first case in Salt Lake County. As Gary mentioned, with the focus on schools, I've asked the epidemiology team and the health department to help analyze the daily case counts and weekly case counts for the age group 5 to 18. So those that would be in a school setting. The chart you have in front of you is Salt Lake County daily case count for ages 5 through 18. And as you could see, over the past 5 days, we've had the 3 highest levels in the past month of cases. In addition to that, as we look week over week, week ending Saturdays, so each of these Saturday of the 5 to 18 group, we are up near the July numbers in this age group, and we continue to look and analyze how we could support schools and families and residents, making sure that we lower these levels. With that, I'll turn it back over to Gary.
Thank you, David. Mr. Chairman, we are prepared to attempt to answer questions that council members may have.
Thank you, Gary, and everyone for that. Council, any thoughts or questions? I would imagine there may be.
Of course I have questions. I'm happy to let anyone else go first.
Go ahead. Just go ahead, please.
All right, so one of the first questions I have, I've been getting some feedback from community members about the recommendation that sounded like when schools hit 15 cases, that would be the time when schools would be moving to 100% online or having a different plan for their education. It sounds like we've had schools in Salt Lake County that have hit that number and have continued to meet in person. Can you talk about the conversations you're having with those schools, or what you would advise parents that are concerned who may have kids in those schools?
Sure, Gary, I'll respond to that. The state plan says that when a school hits 10% or 15, and so in Salt Lake County, it's always going to be the 15, whichever number is lower, that we would recommend that they go to a virtual instruction. And we have done that. And again, it's a recommendation. And those school districts with their elected boards, we share that recommendation with them. We talk about what we are seeing, and then they make that decision. I am aware of 3 schools that have reached that threshold. One of them, I'm not sure what their action for sure has been, because I believe it was reached last night, and so implemented today or the end of today. The other 2, one did go virtual for 1 week, and then came back to in-class instruction. Information is provided to parents so that they know. of this situation, of the potential exposure, and the schools continue to offer the virtual option. And then there was another school that I believe it was yesterday, went with a hybrid model rather than total virtual learning. But again, it is a recommendation from the health department in consultation with the district and the board.
So then the best advice that we can give to parents is to, if they are feeling unsafe, uncertain, it sounds like most of these schools are offering a hybrid option at the very least, so they would still be able to have distance learning for their child. I know that's not possible for every family in this county, but so that would be one thing that I could suggest back, I guess, is what you're saying. And then
yes.
The other would be that really what you're saying is all we can do with this is just advise and recommend behavior. The health department's not in a position to do more than that at this time. Is that correct?
Yes, for the most part, council member. If the situation got so severe at a school and there was not action being taken, I believe that we do have the authority, and I need to work with the DA's office to be prepared for this, that we would have the authority to implement and order. It's confusing with legislation that was passed during the special session that indicated that we cannot have an order that is stricter than the governor's phased guidelines. And the governor's phased guidelines in yellow say school is open. So we need to get that clarified for if that situation happens.
And are we still doing, I know that we've been doing the community-based testing. Is that still continuing at the same rate that it was when we were seeing higher numbers, or have we scaled that back?
Well, no, we're continuing it's been at least 3 months now, I think. We have
the same
weekly,
basic same
weekly
schedule.
Yeah. Yes, Glendale, Rose Park. Yeah, you've been to those, and
yes, I have. Yes. And then do we also have the ability, when we see these numbers creeping up in some of our larger schools, do we have the ability to send a response team there to help more people who may want to opt into testing? Are we doing that?
We are just now facing that first time when we have different hotspots. And so we are preparing to ramp up to be able to provide that service elsewhere.
Okay, so you would say that that's on the horizon, a version of that, either near the school, at the school, potentially to get quicker access. I know that I'm hearing today that there are people experiencing long lines at a few of our clinics around the county. I'm guessing it's driven by some of the activity that's happening in schools. And if we could be deploying testing resources to those schools, to those parking lots, I think that we could help parents and kids in our community feel a lot safer, a lot faster. Especially if we have the testing capacity that I've been told repeatedly that we do have. It seems like we should be able to get more tests pushed out into these community hotspot zones.
Yes.
Okay.
Mr. Chair, this is Amy. I have a question. Gary, I know I've heard of some different types of testing that are now coming out on the market, the saliva test where we can get results in a matter of hours instead of days. Is there any possibility that we're going to be able to utilize that throughout the public soon? I feel like getting those results back sooner is so key in helping our kids and families get back to normal if the test result is negative and all of that. Where are we on those types of tests?
We've teamed up with the state health department and other health departments across the state to purchase some of those supplies, some of that testing technology. so that we could get the best price possible. I believe we are supposed to be receiving that in October. Now, that it's not an answer to everything. At least some of the rapid tests are not accurate with asymptomatic tests. And so to say, well, geez, somebody is in quarantine, they don't have symptoms, so let's just get them tested to see if they can come out of quarantine. It's not going to be successful. It's not going to be an effective tool unless those individuals have symptoms. But we are working on getting that type of capability here in the county.
Great, thank you. And then I just have another follow-up question. And Gary, I don't know that you're the best one to answer this because I know this is a little more detailed. And for the mayor's office, this may be something better for you to email out to us when you have it. But it would be really great for us to get an idea of the different facilities that we own in Salt Lake County, specifically under Holly's portfolio, like our convention centers, our arts facilities, things like that, that it would be nice to know what the status is, if they're still closed, and why, or what the plan is for opening some of those. I know our rec centers are starting to open. I know the library is doing some things to creatively be able to service our residents, but it would be great to know on these other facilities, like what the plan is. I know, for instance, Health Center Theater is already up and opening, and they figured out a way to do masks and do it in a way that they can still host some of their shows. I'd be interested to know kind of what the long-term plan is with, I hate to say our new normal, but we know at least for the short term, we're going to be looking at things the way that they are now with social distancing and masks and sanitizing. It would just be great to kind of get an update on which facilities still aren't open and what the plan is on those. So I don't know if that's something, Mayor, if you can, Chris, with your people, get something like that so that we know how to answer questions when people ask about some of those things.
Sure, absolutely. Holly can come next week, I'm sure, and we have that information. I'll tell you just sort of anecdotally, this is a topic of conversation. One of the unknowns is the impact of younger people now receiving COVID and these school issues. And we knew that going into the school year. Last year when COVID hit, there were many unknowns, but we saw school coming to an ending, and it came sadly to quite an abrupt ending for most schools. And we faced that as parents, right? But we were also seeing the ending of winter, and now we're going into a winter and we're going into a school season. So a lot of the conversations we're having, especially with some of the smaller arts performing groups, is, what really is safe? What, we have some guidance. It's been in place for quite some time from the state with the color coding. We have our own facilities, so we could be more restrictive should we choose to do so. We actually have the symphony who is going to perform, and Holly and Aaron and I have talked quite a bit about that and their procedure, and I know that the symphony management team is looking at it as a case, as a sort of a test case with this first performance. Is there an audience demand? Can they afford to perform with some distance? They've done a great job, from what I've been told, to create 3 rows of separation from the performers. They're not going to have the winds. They're just going to take away, they're going to mitigate the risk. But really, we as consumers of arts and culture and our libraries and what have you are the ones that really are going to have to feel safe to show up. So it's sort of that balance between success for these organizations, revenue from our venues, understanding on our revenue impacts, where we can apply COVID funds and where we cannot, and what that means to the bottom line, which is what we're going through right now in our budget process. And then ultimately, I think it's a consumer choice. And there, I'm guessing, are probably higher demand for our libraries than we're seeing from some of the smaller performing groups. So would we want to close one of our smaller, like a black box at Rose Wagner, and keep the main area open? So it's very complex. Holly and her team are doing incredible work. I've engaged directly because there's a lot at stake with these choices, right? And all the while, Gary and his team are doing the best to kind of evaluate. So we are on it, and we have a lot of information, and I'm sure Holly's able to come next week. If it works with the council's agenda to add her, we would do so.
We'd be happy to have Holly come, and also we could have Dan Hayes and Kimmy come and talk to the convention facilities. Those don't fall in Holly's portfolio, but we'd be happy to talk about what we're doing, what our plans are, and all of the precautions we're taking to stop the spread of COVID-19.
Great, thank you so much.